What I love about Geistlich products is that they're consistent, they're reliable, the quality is always there, and I have seen the results to show for it. My name is Allison Rascon. I'm a periodontist. I'm originally from Miami, Florida. I received my periodontics training at the University of Pennsylvania, and I'm now in private practice in Manhattan. I was first introduced to Geistlich during residency. So, of course, when you first get started in training, you're learning a little bit about everything, materials included, and Geistlich was one of our go-tos in terms of using products, whether it was for soft tissue augmentation, bone grafting. That was the initiation. With Geistlich, it was one of the first materials I used. I got to use a lot of other different products, and I found myself always wanting to go back to Geistlich. So now transitioning to the real world where I get to have the choice, I do find myself always looking for my Geistlich products as my go-tos. So I think my initiation with Geistlich, again, was looking at a lot of the soft tissue portfolio in terms of the products, and I had a really good experience. I used actually quite a bit of mucograft, and I always had really great outcomes with them. I love that we get to sort of live in this palate-free world, and you know, times are changing. The technology and the research is there to support that there are other means of resolving soft tissue deficiencies without having to have that second surgical site. We can reduce that patient morbidity and still have great clinical outcomes. So the mucograft line I find to be very comparable to doing for gingival grafts. I always tell patients there's a lot of different things that we're looking for when we do soft tissue augmentation, and we're at a day and age where we can rely on using these alternative products, spare your palate, and still get really great results. In our industry, we're replacing teeth, but oftentimes we're doing full mouth rehabilitations, reconstructions, and that's life-changing. And without having products of quality that we know we can depend on that are going to give us adequate clinical results, that wouldn't be possible. We've also learned that allograft is what can be considered probably the new gold standard. But what does that really mean? Osteoconductive potential, maintaining that scaffold, that's literally what a bone graft is for. But being able to maximize the osteoconductive potential from an allograft, which is the other huge benefit, is the next step. And I think that the MTF processing and the Valos line itself is holding true to that. The processing is so stringent. Every allograft is going through to be checked to make sure that osteoconductive potential is there. And I don't know that any other allograft product out there can say the same. I feel that the quality is consistently there. I love the handling. I love the thoughtfulness. Speaking to Geistlich from the technical side of what they're producing, but not only that, their philosophies as a company and the people who support them, it's very clear that they, as we know, it's a family-owned business, but they very much care about that. They want to maintain that relationship and continue to grow the company in a positive way.